So the Silhouette system is a 3D wound imaging system for patients with diabetic foot ulcers. In simple terms, it's a series of cameras that can be used to monitor the healing process. So the system that we're using in South Derbyshire, along with the pathway change, supports the NICE recommendations for how best to manage diabetic foot problems.
East Midlands Academic Health Science Network has supported deployment of a demonstration of this solution in Derbyshire, working with Entech Health, the Derbyshire Acute Hospital and Derbyshire Community Health Service.
And it uses 3D technology to give you really precise, accurate measurements of wound size. And the software plots that change over time so that the clinicians can see objectively how the ulcer's healing over time. And equally, the patient can also see their own progress and their response to treatment.
It shows us a gallery of how the photos looked over the previous few weeks. So you can instantly look back at photos, previous photos. You don't have to wait for them to upload at all. They're just instantly there when you click on the date that they were taken. It can be viewed at different sites, but at the same time. So simultaneously, two different people can be looking at the same image. So the patient can be in the room at Ripley, in a community clinic, but the doctor can be looking at it at the Royal Derby Hospital at the same time.
So using this type of system has a number of benefits. Firstly, that care can be delivered where the patients want it to be delivered, which is close to home, and it's taken the pressure off the service here so that there's not so much waiting. It's enabled us to access the hard-to-reach patients, so the system is portable enough to go out into patients' homes, so even patients who aren't necessarily able to attend hospital on a regular basis or find it difficult. For me, I could immediately see that this would change the patient pathway.
When I first came, they had no way of measuring them properly. All they used to do was guess them, like a little measure or a end of the knife to see if it was getting bigger or smaller, so it was more of a guess. But with the camera and everything, they're more precise now, which is a lot better.
A lot of the guesswork's gone. That's the best way I could put it. I mean, you got a podiatrist come in, says, oh, that's healed up a little bit. You get another one, because you never get the same one twice. Next time you come, the place, oh, that's not healed up at all. So there was always that doubt until probably a month later, somebody would walk in and say, oh, who hasn't seen it for a while, and say, oh, that's definitely closed up some more. Now with this machine, that guesswork's gone.
The key challenges for implementing this project are around making sure that you've got buy-in from all parts of the system, both clinical and non-clinical, making sure that particularly from the IT perspective, simple things like, does the building that you're working in have an adequate Wi-Fi system? Making sure that when you're actually implementing the Silhouette system, that you have plenty of time to test the hardware and the software.
The governance issues, the commissioning, the procurement was slightly out of my comfort zone, if I'm honest. But we've got a fantastic team around us. The Academic Health Science Network have been brilliant in supporting the project, providing project management initially, valuation, health economics, that's all come from them. And so it's made my life an awful lot easier. I couldn't have done it without that team around me. The advantages are also that we will be much easier able to audit the outcomes in terms of healing. We can look at our antibiotic usage, we can look at our device usage, we can ensure that our patient populations, we are adhering to national guidance a lot easier because we've now got an electronic database that captures that and then we can interrogate.
We're getting about 90 or 100 patients each month, so they're getting more local care and still being able to have the images taken of their feet. And hopefully that's easing some of the pressure in the acute hospital trust, which allows us to see the more acute cases there.
Of all the things I've been through and all the years I've been doing this, there's been nothing better. You can't go backwards. You can't go backwards now and say, well, measuring things and eyeballing things any good now when you've got a machine like this.
In summary, I would say the clinicians absolutely love it. The patients absolutely love it. We've got really promising results so far, and we're all feeling really confident that we'll be able to strive forward and ensure the sustainability of the project in South Derbyshire, where it started, and to deliver it in other places across the country.
And I think being able to objectively say to a patient, your ulcer is getting better, and to be able to show them the graph of it improving has enormous benefits for them. They love to see the pictures, they love to see things improving, and it really gives them a boost in their morale and the feeling that actually there may be an end to this problem.